Welcome, everyone. Thank you for joining us today. I'm Theresa, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. For those of you who are awaiting your test results for COVID-19, you can now obtain your results online. Please check the Ministry of Health's online portal or the link to our website. Please note that at this time, our health unit will continue to follow up with you directly to provide your results. Please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 6,437 individuals have been tested for COVID-19 in our area, and of those tested, 709 tests are pending. I will now share the most current case counts. There are 51,597 cases of COVID-19 in Canada, and 15,728 cases in Ontario. Chatham-Kent has 82 cases, and Sarnia-Lambton has reported 182 cases. Michigan now has 40,399 cases, with 8,957 cases being in Detroit. Today, we are reporting 594 cases of COVID-19 in our community, an increase of 8 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 186 cases have resolved. 20 people are in the hospital. 17% of all of our cases are between the ages of 50 and 59 years, and 22% of our cases are 80 years and older. 40% are male, 59% are female, and 1% is unknown. Our community has lost a total of 50 people to COVID-19. 36 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 7 long-term care and retirement homes who are currently experiencing COVID-19 outbreaks. Please be aware that our case counts that we share each day and post to our website may differ from other local results you hear. This can be true in long-term care homes where, due to privacy issues, results of a staff member are not shared with the facility until the staff member is notified. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending one of the assessment centers. To access the virtual walk-in clinic, please visit ehealthwindsor-essex.ca. We have 2 assessment centers in our area, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit wechu.org for the most current information in case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. Today we are reporting one more death in a long-term care home facility. A female in her 90s passed away yesterday. I'd like to express my sympathies for the families for their loss, and our thoughts and prayers are with the family. Over the past few days and week, there has been a considerable focus on migrant farm workers or temporary foreign workers. As many of you know, Windsor-Essex is home to a large number of farms and greenhouses that employ 8,000 to 10,000 seasonal workers during the peak season. Every year, the municipalities welcomes temporary foreign workers to our communities, supporting food production in the region. The health unit provides regular inspection of bunkhouses, provides education, and collaborate with health and social services partners on a regular basis to support these workers. The team at Windsor-Essex County Health Unit worked closely with the Ontario greenhouse vegetable growers, local farm operators, the municipalities, and the Erie Shores Healthcare Hospital for various public health and acute care needs of this population. One of the key areas that public health is involved with these farms is to control the spread of all diseases of public health significance, including COVID-19, tuberculosis, sexually transmitted diseases, chickenpox, and many more. Even before we had our first case of COVID-19 in our community, we proactively worked with all the partners to ensure that employers and employees have up-to-date and accurate information regarding roles, responsibilities, and actions needed to ensure the protection of communities and mitigate the risk associated with COVID-19. On March 20th, the federal government announced an exception for temporary foreign workers from travel restrictions. Since that announcement, we worked with all our partners to ensure that temporary foreign workers arriving in Canada meet the 14-day isolation requirement. Under the Temporary Foreign Workers Program, housing and day-to-day transportation for temporary foreign workers is the responsibility of the employer, and they must ensure that they are meeting the public health requirements and other restrictions under the Emergency Management and Civil Protection Act. Temporary foreign workers, similar to all residents in the community, must follow all the requirements set out under the Emergency Management and Civil Protection Act, including physical distancing and limitations for social gatherings. Local and provincial enforcement agencies can charge workers and/or employer for any violation under the Emergency Management and Civil Protection Act. Employers participating in the Temporary Foreign Workers Program are also subject to compliant inspections by Service Canada investigators to ensure that all necessary and appropriate measures are being taken to reduce the risk and limit the spread of COVID-19. The Windsor-Essex County Health Unit, Public Health Inspectors, and Infectious Disease Department are in regular and constant communication with farm operators to provide education, support, and monitoring. In addition, the Windsor-Essex County Health Unit has closely worked with the Erie Shores Healthcare to develop protocols for early assessment, isolation, and testing of temporary foreign workers for COVID-19 as appropriate. For more information about the Temporary Foreign Workers Program during COVID-19, visit the Government of Canada website, and we have a lot of information on our website regarding the Temporary Foreign Workers Program as well. Thank you.
We'll now take questions from the media. We'll start with CBC.
Good morning. Would there be a time when you would consider a business an outbreak like you do with long-term care?
Yes, that's a possibility. If we have an evidence of transmission in that business with the appropriate link, we can declare an outbreak in that business setting. And depending on the nature of the outbreak, there can be further actions taken in regards to that business.
Would that be part of your briefing, or would that just be on a case-by-case basis?
So far, we haven't had that situation yet, but if that happens, again, we'll have to make a determination that if it needs a public disclosure, which most of these situation does, we will be releasing that information through our briefing. Okay,
I know there's the greenhouse in, I think it's Chatham-Kent Green Hill. That's part of the Chatham-Kent Public Health. Would that be something similar, that if something like that were to happen down here, that would be considered an outbreak? I just wanted to, just for clarity.
Yes, as I said, that if there is any evidence of an outbreak in any particular facility, yes, that would be part of the disclosure, yes.
Okay, thank you.
Any questions from Blackburn?
So you haven't had any concerns so far or any issues with the migrant farm workers out in this community?
We did had cases of COVID-19 in migrant farm populations in at least 2 homes, and we worked with these facilities to ensure that further spread didn't happen, and all those individuals who were tested positive for COVID, they have been taken care of.
Any questions from CTV?
Sorry if this sounds easier said than done, but out of the 36 deaths out of the 50 come from the LTC. So, we have St. Clair College. I'm just wondering, like I said, easier said than done. is it not easier just to move everybody that has all the outbreaks and move them over to St. Clair College?
So your question is any facility that is currently under outbreak with COVID-19 patients, and if they can move them to the field hospital at St. Clair College? Yes, there are several considerations that we have to make when making these recommendations. First and foremost, it's about the patients, whether they consent to move to a different facility. For many of them, that's their home, where they are, and just like all of us, we don't want to leave our home and go somewhere else, and in a new environment, that could be a challenge. So having those consideration, and then the second consideration, the other consideration that you have to make is the ability of the homes to care for these people. So despite the need that if someone saying that I don't want to leave, but leaving them there could put them at a risk, then it would be a stronger recommendation that no, I think you should consider moving because you're at risk and you are maybe putting others at risk too. So those discussions need to happen. Also, the situation of the home, like how many cases are there? Are there few cases? Are there widespread cases? And whether the homes have the ability to segregate these patients with the sick and the well people appropriately. Do they have enough staffing to do that? Do they have enough personal protective equipment to do that? So all those considerations need to happen before that kind of decision is made. And then in the end, if that's the best solution that we can come up with, yes, for sure, we can do that. But those are the discussion that are based on clinical situation as well. Some people and many of the elderly, they may have dementia issues. You know, if you're moving them from one facility to another, can they cope with the changing environment and how would they react to it? So it's not as easy as saying that, yeah, why don't we just do that? Some of these are conversations that the attending physicians at the facility and the field hospital, they need to have that. And then some of those would be public health recommendation based on the layout and the situation at the home that are currently in outbreak.
Any questions from AM 800?
You mentioned there were two homes that had migrant workers with testing positive. Do you know how many migrant workers have tested positive?
A total of 8 migrant workers have been tested positive at different occasions.
Okay. It appears the number of new cases every day is going down. How do you feel about that? Is this kind of what you were expecting? Are we on the right direction? How do you feel about that?
No, absolutely. I think the combined effort of all our community members, our people, our frontline workers, everyone, I think we worked really hard to get to the place where we are right now, and we are seeing now the benefits of maintaining all those physical distancing requirements, public health recommendations, to not to see the surge. I think we really worked hard as the community in general to flatten the curve, and we are seeing some of those signs. But what we like to see is, again, seeing that trend, and the trend is important because situation can change very quickly, and that's what we are hoping. And I've been very careful in saying that it is about time, but I think we just need to stay on course and continue to do what we are doing and get that consistency in place.
Thank you.
Any questions from Windsor-Essex?
I'm just wondering, will there be another epidemiological summary tomorrow?
And that is correct, yes. Tomorrow I will present the epidemiological summary.
Any questions from the Windsor Star?
Yes, good morning. The 8 migrant workers who tested positive, was that over 14 days ago?
I don't have all the details right in front of me, but I think some of them are still within their timeline of infectiousness and are being isolated appropriately.
You don't seem terribly concerned about that. It sounds like that situation was handled appropriately.
With the cases that we had, yes, that situation was handled appropriately. Would I be concerned if something like what happened in Chatham-Kent would happen here? yes, there's a strong possibility. This is a high-risk population. The work environment, their living conditions, and everything, it puts them at a higher risk of spreading COVID-19 in that population. So that's why most of the proactive work that we have done with all our partners is to ensure that everyone have all the information that they need, very clear about the roles and responsibility that everyone has to take care of that population. It can quickly get to a situation where few people, if they are not appropriately assessed in a timely manner at these farms, could result in many more cases in those farms. So we feel that we have got a good handle, at least at this point, and we continue to work with all the partners to make sure that it stays that way. And we are hoping that all these work will help in preventing any outbreak in these facilities. But I'll just remind you that this is a high-risk population, and any cases that is coming out of the ordinary and not taken care of could result in more cases in these farms.
And separately, I'm just wondering if you have a sense of the turnaround time for test results.
So as we are doing more and more testing, the turnaround time is getting longer, and we have been in contact with the labs and to get some of those results quickly, and they are working on a strategy to prioritize those who are symptomatic, and the diagnosis is really important for many of them. They are giving priority to those, but it is delayed at this point, and we are working with the labs. The labs are working hard to provide the result as quickly as possible.
Do you have an estimate of how many results we're getting back each day? Just looking at the numbers, it looks like as we test more than 100 each day, we're also getting back maybe that amount. So I'm just wondering if you have a number for that.
I don't have a number for that, but I think we are getting quite a big number of tests every day. I want to say at least 150 or more results coming back every day. That will be an estimate, but again, it changes, depends on how much test results how many swabs these labs are getting every day. Some days when they're getting less lab, they're processing more samples. Let's say from Windsor-Essex, we sent many swabs, but they have more capacity to do it. We get more results, but similar to other areas, they're trying to find that balance to cater the need of every region in working with a prioritization matrix and providing the results when it's really important for these health units to get the results.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thanks.
CTV? AMA 100?
No, thank you.
Windsor?
No, thank you.
Windsor Stark?
No, thank you.
Thank you, everyone.
Thank you.
Thank you very much.